I'm Dr. Brian Haas, founder of Hospice Intelligence, an AI-powered documentation platform that helps nurses and physicians create Medicare-compliant hospice notes by checking against LCD criteria in real time. This reduces audit risk and subsequently nurse burnout as well. This week on my LinkedIn, I wrote about navigating hospice audit risk and protecting your agency through better documentation. Today, let's dive deeper into the 7 specific documentation mistakes that are costing agencies thousands, maybe even hundreds of thousands of dollars in audit denials. If you're a hospice nurse watching this, you know that feeling. You're sitting at your computer after a long day of patient visits, staring at that blank documentation screen, wondering if you've captured enough to satisfy Medicare's requirements. You're not alone. And today, I'm going to show you exactly what auditors are looking for, and more importantly, how to avoid the pitfalls that trigger denials. You've probably heard these numbers before, but let me go ahead and paint the real picture here. Medicare hospice spending has exploded. We're talking about $1 billion of growth every single year, and with that growth comes scrutiny, intense scrutiny. Right now, there are about 3 different types of audits that could hit your agency at any moment: ADRs or SMRC audits, those additional documentation requests that seem to come out of nowhere. Then you have the TPE audits that put you under the microscope for 3 rounds of review, and UPIC audits, the ones that can literally shut down your agency. So what triggers them? Number 1, if you're billing more than 20 to 25% of your days as GIP or continuous care, that's red flag number 1. If your median length of stay exceeds 180 days, that's another red flag. And here's the kicker. The average hospice sees 5 to 10% of claims denied. That's not a small number. For a $2 million agency, that's $140,000 walking out the door. And you know what causes most of those denials? Human error in documentation. That's why I built Hospice Intelligence, to catch those errors before they become denials. So let's start with the first one, insufficient decline. The number 1 reason for denials, documentation that doesn't support a 6-month prognosis. Now, I see this all the time. Nurses write things like, the patient is comfortable, or good day today. I get it. We're trained to look for the positive, to celebrate those good moments. But Medicare doesn't see comfortable as dying. They see it as, well, stable. So here's what you need to do instead. Don't just say the patient is declining. Show it with numbers. Instead of patient week, write this. The patient's PPS declined from 40% to 30% over the past week. They now require total assistance for transfers, whereas they were previously a 1-person assist. Their weight dropped 3 pounds in the past 7 days, and that's a 2% body weight loss. Objective, measurable, time-based. That's what Hospice Intelligence prompts you to capture, those specific data points that paint the picture of decline. So what's mistake number 2? Missing LCD criteria. This one is huge, failing to address LCD criteria specifically. Now, every Medicare audit contractor has slightly different requirements and they capture different criteria, but here's the reality. You can't memorize these all. A dementia patient needs completely different documentation than a COPD patient. The FAST scale, specific complications, weight loss, percentages, miss one, and you're looking at a denial. In my experience as a medical director, I've seen brilliant nurses, truly exceptional clinicians, get dinged on audits simply because they didn't know their Medicare required documentation of pyelonephritis in the past 12 months for dementia patients. That's exactly why Hospice Intelligence checks your documentation against your specific Medicare LCD criteria in real time. As you're typing, it's flagging what's missing. No more memorization, no more guessing. All right, what's mistake number 3? It's inconsistent team documentation. So inconsistent documentation across your team. This one drives auditors crazy. Picture this scenario. And this happens all the time. Your nurse documents the patient as bedbound, PPS of 30%. But then 2 days later, the aide writes, helped patient walk to the bathroom. Well, which one is it? The auditor doesn't know, and when they don't know, they deny. Working with hospice teams across multiple states, I've seen how this happens. Different team members assess at different times. The patient has a burst of energy during the aide's visit, but nobody explains the discrepancy. This is what we need to capture before they become problems. Hospice Intelligence can help flag when documentation doesn't align and prompt you to clarify. Hey, this differs from yesterday's note. Please explain the variation. All right, mistake number 4, copy and paste narratives. This is a big one for physicians, and this one is also for nurses as well. Copy and paste certification narratives. Look, I understand you're seeing dozens of patients. You're pressed for time. That template is right there, ready to use, but auditors can spot copy the language instantly. And when they see it, they question whether you actually evaluated this specific patient. Medicare requires your clinical judgment, your specific assessment of this individual patient, not a template, not last month's narrative with the date changed. Here's what Hospice Intelligence does differently. Instead of giving you a template to copy, it generates unique narratives based upon the actual clinical data that you input. It helps to identify recent changes, specific symptoms, and aligns with Medicare LCD criteria. Mistakes number 5 through 7. We're going to do this in a rapid fire sequence to save some time here because they're equally costly. Mistake number 5 is missing comorbidities. Don't just list those secondary diagnoses. Explain how they interact. How does the COPD make the dementia worse? How does the diabetes affect wound healing? Hospice Intelligence helps you to make these unique connections explicit. Mistake number 6, inadequate weight documentation. Not just losing weight. Give me percentages over time. Weight decreased from 145 to 132 pounds over the past 60 days. That's a 9% loss. And our platform, Hospice Intelligence, calculates these percentages automatically as you document. Mistake number 7, the automatic denial is missing a face-to-face encounter. Miss that 30-day window by even 1 day and your claim is toast. So we need to connect those comorbidities, document those weight percentages, and we need to track those face-to-face deadlines. So here's the thing, catching these errors after the fact, after you've submitted claims, after the documentation is done, well, it's too late. The damage is done. What you need is real-time support. As you're documenting, as you're writing that note, you need to know what's missing. You need to know if you've captured those LCD criteria. You need to be confident that your documentation will stand up to any audit. So that's what we've designed at Hospice Intelligence. We support nurses and physicians by simplifying your compliance, reducing your burnout, and creating more time for what really matters, patient care. When you're using our platform, you're not alone. You've got an AI assistant that knows every LCD requirement, catches every inconsistency, and helps you create documentation that's bulletproof. It's like having a compliance expert and a documentation coach sitting right beside you, but without the judgment, without the pressure. Look, I've been where you are. I've felt that documentation burden. I've seen talented nurses leave hospice because they couldn't handle one more denial, one more audit, one more night spent fixing documentation instead of being with their families. That's why I built Hospice Intelligence, not to add another layer of technology, but to make your job easier, to give you confidence, to protect your agency while freeing you up to do what you do best, care for patients and families during life's most difficult journey. Thanks for watching. I'm Dr. Brian Haas with Hospice Intelligence, helping hospice nurses and physicians document with confidence, compassion, and compliance. If you'd like to learn more about how we can help your agency avoid these costly mistakes, check out this week's LinkedIn article below. And to every hospice professional watching, thank you. Thank you for the incredible work you do every day. You deserve tools that support you, not burden you. Let's make documentation work for you, not against you.